Hello.
Hello. Good morning.
Good morning.
I guess
Good
it's
morning.
afternoon.
It is just
Yeah.
12:20.
The conversation we were chatting about this morning, we thought would make a great consult with me. And that is the difference between fee for service and concierge models. Obviously, everyone knows the difference, but I think more and more we're being faced with people we collaborate with that have concierge practices. So I just want to chat about that just for a few minutes.
Sure. So I think there is a little misunderstanding about that. Fee for service means that a physician is paid from some source for the work that they have done the work they've done for a particular patient.
Right.
That could be paid for by an insurance company or by the patient themselves. That just means that they get paid for the work that they do, as opposed to being on contract with an insurance company or a multi-specialty practice. The concierge concept is maybe better referred to as a membership, that the patient and physician have a contract that for a certain amount every month, they will get a level of care, and the numbers of patients that physician sees is usually limited, which gives them more time for their concierge patients. Or maybe all of their patients are concierge patients.
Yeah. And they're paying really for access.
Yes.
That's what it is.
That's exactly right.
So they're paying for access when they need it to that physician.
Yeah.
Because oftentimes we get asked the question, or people say when they're describing our practice, that we are a concierge practice.
And we're not.
And we're not.
We give that level of care of having really lots of time for patients.
Exactly.
But we are fee for service and not contracted with insurance companies.
Mm-hmm.
We do not accept what the insurance company says we should accept for a particular service.
Yeah.
And very frequently, the insurance company won't pay for that.
Right.
So that's a cash-based practice, no insurance contract. But that's not exactly concierge. Concierge is a membership.
Yeah.
Fee for service, it can be either paid for by an insurance company or not. And in most cases, fee for service will not have contracts with insurance companies because we feel that we're giving a better level of care than the physicians that are accepting insurance.
And I know how you feel about this. You'd rather just get paid when you see a patient.
Yeah.
It's because we've talked a lot about, well, we have in the past, should we move to a concierge model?
Yeah.
The actual
right.
membership. And we always go back to, no, let's just keep it this way.
Yeah, fee for service.
Fee for service. And then what do you think about practitioners charging, let's say it's, I don't know, $1,500 a month for access? Do you have an opinion?
The whole concierge concept is, there's a question, is it worth it to the patient to have that access? Sometimes it's very expensive, but there are different levels of access. There are different things that are included. The number of house calls, the number of office visits, the number of examinations in a period of time.
So if you needed to see someone a lot, it
could be very beneficial.
Yeah.
But if you're really in good health and you want to see somebody just once a year, then maybe fee for service, non-concierge is the way to go.
Yeah.
But then it's difficult to get in to see a patient that's not a concierge.
A physician.
Yeah. Sorry. It's difficult.
So the access is important, I think.
Yeah. In this town, in Santa Barbara, a lot of internal medicine, primary care physicians have switched later in their careers over to a concierge practice.
And that makes sense to me.
Yeah. They've had patients that they've had for years. Patients don't want to change.
Yeah.
They're giving access to the patient. The patient knows what they're getting.
And there's so much now to keep track of that we're trying to keep track of as we're getting older.
Absolutely.
Lab work and all the longevity things and lipids and wanting blood sugar and wanting to make sure the therapies you want are working.
Yeah.
So it is more labor intensive for.
Yes. Yeah, the concierge patients expect more, and
Yeah.
that's not unreasonable.
Yeah.
So it's, but one of the difficulties that occurs significantly in this town is access. And so sometimes it's necessary to pay for that.
Yeah, I agree.
Thanks.
Thank you.